Hey guys, hold on. Let me get this muted. Woo! Hello, everybody. Welcome to J is for Justice. My name is Jay, and I am your host. Let me know if you can hear me okay. I don't sound like a chipmunk or anything like that. Nothing crazy. Welcome to my Thursday, November 2nd show. Thank you for joining all the moderators. And I've got Potato that's going to come up with me in just a second here. We're going to be going over some testimony that I found and that was really important in this trial. If you haven't followed this trial, don't worry, because we're going to give you a little synopsis before we begin. But I think it's important to kind of showcase this social worker's testimony because it's really scary. It's really scary, and you guys are going to see why. But let me bring Potato up first. Let's talk to lovely Potato.
Hello, hello.
Hello, my darling.
Can you hear me okay?
Mm-hmm.
Hello.
You sound like you're hiding in a corner. What's going on?
Uh-oh.
Uh-oh, she can't hear me. Hello, Kelly Barrison. Hello, Lexi
Can
Texi.
anyone hear me?
Yes, we can hear you. We can hear you, but she can't hear us. So let's talk about her while she can't hear us.
You can hear me now. Okay, cool.
Can you hear me? I don't think she can hear me.
I think I'm on a delay again, aren't I? I can hear you.
Oh, okay, you can.
Oh my gosh, yeah, but
I
it's
just
really
counted
delayed.
to 4.
Sound
check. Mandy Joseph, sound check, mic check, 1 2 1 2, mic check.
Yeah, literally.
Well, I mean, we are communicating across the pond, so you have to bear with us because we have a delay. You know, it takes time for that signal to go across the water.
5 seconds though.
We'll deal with it. Fuck it. We'll do it live. Fuck it. Just like Bill O'Reilly. We'll fucking do it live. All right. So let's start out. Let's start out with a brief recap. I've got this all ready to go. Oh, she just dropped. She gonna come back. So here's our recap, you guys. We are talking about the Kowalski family. Okay, Jack and Beata. Beata's the mom. Beta. I think it is Beta. Now, Beta was born in Poland and immigrated to the United States at the age of 16 years old. After she married Jack, they had 2 children, one daughter named Maya, and then they had a son named Kyle, and they live in Venice, Florida. So not far from me, maybe like an hour and a half south of me. So it's important to note too that they had a problem having kids in the beginning. So they had all of this in vitro done, and they had Maya. So Maya was like this miracle baby. You know, we've heard of people who can't have children and then they have them and they cherish them, right? They can't let them go. They really cherish them. So that's what happened with them. But then lo and behold, with Kyle, it was like, boom, they just got pregnant. So in early of 2015, Maya was 10 years old and she began experiencing breathing problems, headaches, blurred vision, chest congestion, skin lesions, all kinds of weird, like lower limb dystonia and chronic pain. The family went doctor after doctor, hospital after hospital, and got no diagnosis. So no one was able to tell them what was wrong with Maya. Now, Beta was an infusion nurse. Okay, so she was in the medical field. So she started documenting every appointment meticulously. She kept notes like a diary of every appointment, what every doctor said, where they went, everything. And she was searching the internet trying to find answers of what's the matter with Maya, right? So finally in September of that year, she sees an anesthesiologist, Dr. Anthony Kirkpatrick. And at that time, he diagnoses Maya with advanced complex regional pain syndrome. And from here on out, we'll just call it CRPS. And this is a disease that can be treated with the drug ketamine. After low doses of ketamine were ineffective, Dr. Kirkpatrick recommended a ketamine coma. And they showed us a video during the trial of what it's like to be in a ketamine coma. It's really bizarre. Like, she hallucinated and all this weird stuff. Okay. So it's illegal to do here. So they had to take her to Mexico for the ketamine coma. So they went ahead and did that. They said it was successful. She improved, but they can't afford Dr. Kirkpatrick's treatments anymore. So they're recommended to another doctor, and he prescribed 1,000 milligrams of ketamine daily for Maya. For a year, her symptoms were minimal and the family returned to normalcy. During Hurricane Matthew in 2016, Maya had a relapse. So Jack, her dad, took her to the emergency room at Johns Hopkins All Children's Hospital, right here in St. Petersburg. Because her mom was at work. So her mom was working as an infusion nurse. Hold on. So during this hurricane, he takes Maya to the hospital. The hospital is unfamiliar with the condition CRPS. And they're concerned at the amount of ketamine that Maya is being given every day. After her mother arrives at the hospital, the physicians comment and have made note that her mother was belligerent, demanding, and controlling regarding Maya's treatments. The hospital staff did try to treat Maya with little improvement, and they begin to question the validity of Maya's diagnosis. So her mother gets frustrated with the care that Maya is receiving, and she starts talking about pulling her out of that hospital. So at this point, the staff of the hospital has suspicion that Maya is a victim of Munchausen syndrome by proxy, and they contact CPS. And this is where it all unravels. So Maya is confined to the hospital without her parents. Her mother is unable to speak with her over the phone, which frustrates her mother greatly and causes her to criticize the hospital staff. So now mom and dad start fighting because her dad, Jack, is saying, just stop, creating waves. Let's just get through this. And she's, digging her heels in the ground. So a judge issued a no contact order between Maya and her mother. Can you imagine? Your 10-year-old's in the hospital and you get a no contact order. So she's freaking out because she's been in control of Maya's care this entire time. Like, she's been when I say in control, she's been in control. So after 4 days, her dad is actually allowed to see Maya under conditions like he can't talk about her treatments. He can't talk about her care. He can only talk about just mundane stuff. But he does it because he wants to have eyes on Maya. He wants to be able to see his daughter, right? So without the ketamine treatments, he's distressed at the sight of his daughter as she's worsening. So then finally, her mother is allowed to speak with her again on the phone, but she's ordered to do so under the supervision of this social worker we're going to talk about, Bedy. So they looked her up and they found online that she had been arrested before for child abuse. This is a social worker working in a children's hospital. So they figured it out. And then after one call where Maya cries for her mother and expresses wanting to go home, Bedy, which is Bedy, the social worker, tried to get the calls prohibited and revoked. She didn't want Maya to be able to talk to her mom at all. So then her mom is under pending investigation by Sarasota County Sheriff's Office. A detective interviews the dad and says if she could be released and have no contact with the mom, would you leave Maya's mother? And he said yes, without a doubt. Without a doubt. So now the family suspects that law enforcement wants them to turn on each other. So now they have further strain between Jack and the mom. So the mom's already distressed. Now she feels like, oh my God, the cops are trying to turn my husband against me now. So she's feeling really desperate, right? So then they go through several court hearings that result in the judge siding with the hospital and the doctor, that's Dr. Smith at the hospital. During one hearing, Beda requests one hug with her daughter, and this was denied. Denied. So devastated, she finally reached her breaking point, and on January 8th, 2017, 87 days without her daughter, Beda took her own life. In 2020, so fast forward 3 years, this happens. A reporter named Daphne Chen is investigating child welfare in Florida, and she comes across the Kowalski's case. She discovers there have been several cases like Maya's, all originating from reports made by this Dr. Smith at All Children's. So Jack decides finally to file a lawsuit against Johns Hopkins, Shopkins, All Children's Hospital. And the trial began in late September. So it's Jack Kowalski on behalf of himself, Maya, Kyle, and the estate of Beda are suing for $220 million, $55 million in compensatory damages, and $165 million in punitive damages. And there's actually a Netflix on this case if you're interested in watching that. Welcome back, Potato.
Hello. Sorry about that.
You okay?
I heard you say, let's just do it. And then I was out.
Oh, I know. I'm like, she'll be back. She'll be back. So I went.
Can you hear me?
Mm-hmm. So I just went through a brief rundown of the case. And I want to read some of these comments. Jammers, I'm still confused as to why the mom thought my daughter's in the hospital, super sick, and I can't see her. Maybe I'll kill myself. Right. I think that there had to be like mental issues, in my opinion, going on prior to this, because that's not normal. It's not normal for your child to be, what you think is suffering, and you like say, peace out. Like that's the time when, as a mom or as a parent, you're like gearing up in mama mode to like be there and figure out what's going on. And I mean, maybe she was drained from that. And I think too, she grew up in a communist country, so she had like probably some trauma from her childhood as well. Potato.
It is also really difficult when you're in that kind of situation with a child with complex needs and you've used a treatment before that's worked and she's got better. And then they're saying, no, you can't do that. We're not going to do that here. And your child ends up in a load of pain again. And they're blaming you. So they were treating her like a criminal, not letting her see her for 3 months. That's a long time for you to mentally decline into depression. And we all know that when you get to that kind of point, like you're not thinking. And the only way that her daughter could go home and stop being around those people in that hospital. It's a drastic measure, but
I don't understand it though. I don't. I just feel like it was more than just Maya. I think that was the basis of it, but I think the fact that maybe she felt that Jack didn't have her back, like he's telling the cops, "Yeah, I'd be without her if I could bring Maya home." Like she probably felt alone.
Yeah, exactly. That's a lot. That's a lot to have on your shoulders. And especially thinking that you're the reason why your daughter's being held in hospital and you know that she's upset and she's not okay in there. And she knew if she wasn't around, then her daughter could come out. And she did. She was released.
Thank you so much, Flo. Flo just sent a Cash App donation. Very generous. Thank you so much, Flo. Flo is my lady, my main squeeze, Flo. Let's see if we got a sound bite for that.
God almighty.
God almighty, that Flo is amazing. So, all right. So that's the basis of it. Whether we think it's out there or not, this is what happened, right? Sad. It's very sad. But one more thing before we get into the actual testimony that I wanted to, I don't know, I didn't find this out until after the fact about, Miss Bedy. Is it Bedy or Bedy?
Mhm. Bedy.
Beady eyes.
Bedy.
We'll
I
just,
don't know.
I'll never forget now because I'll think of beady eyes. All right, let me get this up here. So we're gonna go back in time and go back in time to Miss Beatty. Hold on, let me get this up here. And you guys are getting kind of a bonus here because we didn't find this out until after we started looking into and watching this. So real quick, this is from Florida.
This was shocking.
Oh, so shocking. June 21st, 2007. A manager and therapist at a children's mental health program were jailed on child abuse charges last week after holding a 10-year-old boy on the ground and covering his face with a towel, police said. The incident started when the boy, a client at the Suncoast Center for Community Health, walked into an office there June 12th. He then ignored a manager who asked him several times why he was there. What happened next stunned other employees. The manager, Catherine Bedy, grabbed the boy's head, causing him to fall down. Bedy placed both knees on the boy's chest. The boy's face turned red and he couldn't breathe. According to an affidavit, Bedy replied, "Yes, you can." A therapist, Veronica Lortz, got a white towel and covered the boy's face. She did nothing when the boy asked for help. Other employees at the office called police who arrested Bedy, 46, and Lortz, 63. They each face one felony count of child abuse. Bedy did not respond to a request for comment. Lortz said she couldn't comment, and her attorney didn't respond. Both women have been fired, according to the Department of Children and Families. Suncoast is a private. That's one thing too about Florida. Our CPS system is privatized. Suncoast is a private St. Petersburg nonprofit organization that receives funding to provide various mental health services for children. It provides most services to children in their homes, but some kids with severe mental or emotional problems come to that office at 1001 16th Street South. Bedy was the manager of a special therapy program for children in foster care. Dare said the 10-year-old boy, something about that age too, man. That's Maya, 10 years old. Now we got this boy, 10 years old, who is not being named because of his age, is in that program, which has about 23 children. So that's pretty much it on that. And you can't find anything else. I searched court records here in Pinellas County. Nothing.
The charges were eventually dropped. I don't know why they were dropped, but they were. So she didn't face anything for that, which is shocking.
So that's why
she's dealing with
working.
children that are in. actually had charges shouldn't be allowed to work with kids again, especially when she's working with kids that are already in care. Those kids are vulnerable children. And that kid just walked into the center, and just because he's not speaking, they decided to push him to the floor. Like, what is that about? It's
Right. Like, what are you
unbelievable.
doing
She
here? And then he
disgusts
wouldn't
me.
answer. It's like, what do you think he's doing here, lady? You're a freaking therapy place. How about you be a little kinder?
Exactly.
Okay, so here we go. This is her testimony right here. And how fitting that she shows up with the clutching of the pearls. I couldn't believe it. When I saw her, I was like, what? She fits the bill in every like way. You know what I mean? Like every like stigma you could have with a horrible social worker. She's like, you look up a horrible social worker in the dictionary, and there's a picture of her on the stand. Carlin.
Mm-hmm. Yep. And she changed her appearance as well from her deposition. She didn't look like that. She had dark hair. Now she's got light hair. She tried to soften herself up, I think, but it kind of didn't work.
She did, didn't she? Let me show you guys what she looked like before. We'll pull up her deposition real quick. This woman's a piece of work.
She can't change a sour old face, though, can she?
So here she is with her brunette hair. This was in 2019. She's wearing a big old cross in this one. She just looks like a nasty old bitch, in my opinion. All right.
She's so fit in that soundbite.
She's an old bitch in my estimation. Okay, so we're gonna pull this back up. Okay, so I know you're on like a 5-second delay. So after I'm gonna let it play through, and I'll stop at certain things. I'll wait and I'll let you respond first, so that I'm not confusing you. Carlin just choked on her gum. Okay, so I'll let you kind of get your thoughts out first, and then I'll follow up when you're done. Okay? We'll get through it, potato. No worries. All right, so this is Kathy Bedy, who used to be, or Bedy. She's a Catholic. She was married to a pastor, and this is her.
You testified you were Roman Catholic. Isn't it true that in the 90s you were actually part of First Christian Church?
I was.
That's not a Catholic church, is it?
No, at the time I was married to a preacher.
It was recently. All right. So on the photos then, according to your testimony, and tell me if I'm wrong here, everything went pretty smoothly. Is
Yes.
that right?
Yes.
And you were pretty positive at the time that you were doing the right thing. Would that be true?
I was doing what risk management asked us to do. Yes.
Because risk management told you to do it, right?
I guess we should give some background to the pictures, Potato. Do you want to do that?
Are they not going to show them?
Oh my God.
I don't know which part of
Oh my
this
God,
it
you're
is.
so loud. You're so loud. Hold on. It's
really?
my booster. It's my booster. Okay, sorry about that, guys. I'm boosting the volume for the video. Okay, yeah. So this is kind of what they're talking about, her taking these pictures.
Oh. Yeah. Well, she contradicts herself a lot in it, because she originally said that she was asked by risk management, or she originally said it was a doctor. It keeps changing who asked her to take these pictures. And basically there was only her and the bedside nurse in the room at the time. She's saying that Maya was fine with the pictures. Maya's saying she wasn't fine with the pictures. It was a traumatic experience for her. The pictures show her on a bed that she literally told her to strip down naked. And Maya said, I don't want to strip down naked. Like, she's a 10-year-old girl. Why would she want to get all of her clothes off in front of this women that she doesn't know, and have pictures taken of her for who's going to see them. She didn't know where they were going to go or who was going to see them. So she had to come to a compromise with Kathy for her to keep her training bra on and her underwear.
Wow. And then she's denying too that she touched her, correct? That's what's coming up too, is whether it was her hand in the photo, right?
Yeah. So no one's really cleared up whose hand was in the photo, but because there's two pictures. One of them shows her lying on the bed holding the nurse's hand, and the nurse said that they were her hands. But there's another picture where you can see Maya's hands on the neckline of her shirt, and another hand that was trying to pull her shirt down. So Maya said she was trying to pull her shirt up because she didn't want it to be pulled down, and this other hand was pulling it down. And no one's claimed that to be their hand. So the nurse said it wasn't hers. I think Kathy said it wasn't hers, but there was only two people in the room, so whose hand was it?
Right. And the nurse was black. So you can clearly tell that the hand isn't a black person's hand. So
Yep.
it's like they're both like the nurse, the black nurse testified, oh no, those aren't my hands. And then Kathy Bedy's like, no, I didn't touch her. And it's like, okay, one of you bats touched her because there's hands on her. There's hands on her.
Exactly. You can clearly see it's an adult hand next to Maya's two hands on her shirt, pulling her shirt down. Someone was doing it. And if there's only those two there, it's got to be Kathy. But she won't admit to touching her.
And then there's another twist, right? Because in the photos, and she's got two different bras on. The little girl's wearing like, training bra. She's got a white one on in one photo. She's got like a Hopkins one on in the other one, and different shorts. So it's interesting to note, and I know I use that term all the time, but I watched Maya testify again yesterday. And she said that was because they told Maya, you have to have these pictures taken before you can go home and see your mom. Because she was planning on or before you can see your mom in court or whatever. I don't know if she was going home or what the deal was, but they were going to court that day, and they were getting Maya changed into a dress to go to court. So Maya says those pictures were all taken pre-court. Because the thing was, this lady testified, one of her stories was that Department of Child Family Services said, take pictures before she sees her mom and take pictures after she sees her mom to see if, she's self-inflicting some things on Maya, like those lesions and stuff. But Maya's saying, no, after court, they only took a picture of me sitting fully clothed in my wheelchair. So I don't get the point of them taking them all at once.
Yeah, I'm not sure if she was asked to take them or if she was kind of exerting her control over the whole situation because she didn't want Maya to be out of her sight. Like if Maya refused to take pictures, she wouldn't be able to go. So she had to literally force her to get them done in order to go to court.
I would really like to know
because
if
they weren't logged in a medical record, and like you said, pictures weren't taken afterwards. So they didn't have they're supposed to take them as a comparison, like you said, but there was nothing to compare it with. So there was no reason then to take the pictures in the first place. So there's got to be another reason for her wanting to do that.
You know what I think? I think that she was so hell-bent on proving that Beta was doing this to Maya that I think she was trying to kind of take matters in her own hands. And then I think she thought maybe she'd be able to come out and say, hey, see, look, look what I discovered. Because it seems like she was going toe to toe with the mom. I don't know. I mean, why else would she do this? She's a creep.
100% she was.
She's a creep. All right. So now we're going to listen to her. This gives you some background on the photos. And also in one of the photos, you can see Maya's mouth, like it's cut off right here. But you can see she's freaking bawling in the picture.
Yeah, she is. She's literally straining. Like you can see her tensing up. Her ribs are showing. So when you can see your ribs like that, it means you're tensing. You're either holding your breath or you're breathing deep or you're exhaling or whatever. So her mouth was downturned, her chin was faced up. She was
And her
tense. She
face
was
is
not
red.
relaxed and okay with the situation. Yeah.
And they had to hold her hands. You know, I mean, they weren't like holding her down, but I don't think Maya was really going to fight them. You know, she was more succumbing to the situation, but distressed over it, like a
That's another
10-year-old.
thing. Yeah, like the nurse was saying, Maya was okay. She didn't see any signs that she was upset or crying. But then when she's asked why she's holding her hand, she said that she was comforting her. Why do you need to comfort her if she was okay with the situation?
Right.
Contradiction.
And why make her lay down for photos? Like, why isn't it not sufficient to just take pictures of her arms and legs? Very intrusive.
Right, exactly.
Someone holds my kid down on a bed in a hospital and takes pictures of her in her shorts and a bra at 10. We've got some problems. Because the parents weren't even asked.
The other thing as well, Maya said that when she'd come to this compromise with Kathy, she'd said to her that she wanted to make sure that these pictures that were taken on the camera couldn't be seen by anyone else. And Kathy told her that she would take them and log them into the system. And so when the pictures were done, she went over to the computer system and made it look like she was putting them in, but she actually didn't. They're not in her file.
What'd she do with them? Do we know?
She must have kept them on her camera.
Ew.
But they weren't filed like they were supposed to be or like she'd agreed to.
And she still has a job?
I don't know if she does now. Yeah, I'm not sure.
She might be of retirement age. I mean, she was 46 in 07. And yeah, I don't know how many. I'm not good at math, but seems like she'd be getting close to maybe retirement. So maybe she early retired. But this woman is definitely evil. Evil. There's
Let's
no
hope she
soft spot about her.
has retired. She doesn't want to be around any kids.
I just can't believe, even if the
There's
charges
no
were
remorse
dropped,
whatsoever. She doesn't care.
I can't believe that after the charges were dropped, that anyone would still hire her. Huh. That's what's scary to me. So how can we
I know,
trust
shocking,
this system?
especially that.
It is Angie B. Okay, let's get into her testimony now. You guys have some more background on it. If you have any questions, go ahead and put them in chat. When we stop, we'll go over them. So we're going to watch a little bit of this, and then I'll stop it. Potato can comment, and we'll take some of your questions.
Pretty positive at the time that you were doing the right thing. Would that be true?
I was doing what risk management asked us to do, yes.
Because risk management told you to do it, right?
Yes.
I'll get in that in a moment. But really, though, you felt that the whole thing you did was very unfortunate. Isn't that true?
I don't know what you're talking about.
Well, do you remember your deposition of January 30th, 2019?
Can you refresh my memory?
Sure. Yeah, I'm coming. I actually have it on video, but.
They take a lot of sidebars too, so I'll skip through those.
Looking for my page number, sorry.
And I know this guy seems boring, but he really brings it. Give him a chance. He's kind of Bueller, but he really brings it.
Sorry, I have it right here. They're going to find the page number, and I'll move right back. But so we're certain you felt that this was, is that it? Sorry.
She don't crack. a smile.
Page 232, line 8 to 235, line 4. May I approach, Your Honor?
You may.
I'm sorry, did you say 232?
232 to 235.
232 to 235.
You wanted to read 4 pages? Objection, Your Honor, it's improper impeachment.
Well, she asked to refresh her recollection, so right now I think we're talking about refreshing recollection,
Okay.
not impeachment.
It's fine.
Thank you.
Having now read that sworn testimony, would you like to correct or change the testimony you just gave the jury?
Objection, Your Honor.
I'll sustain the way the question's phrased.
Having had your recollection refreshed, would you agree that you stated unfortunately as to the photo session?
So I think it's always an unfortunate thing when we have to do something like that.
And Maya did not want you to do it, did she?
She did not.
She was crying, was she
She
not?
wasn't crying.
She was very upset,
She was upset.
and she kept telling you no.
She did not.
You sure she didn't say no? And where did you get permission to do this?
I'm not sure.
Objection, Your Honor, reapproach.
They take too many sidebars, but we'll breeze right through it. Miss Kathy and her bitchy ass, resting bitch face.
So I found that Kathy Bedy is still an active social worker in Florida and does counseling through CVS Minute Clinic.
Through which clinic?
Minute Clinic. CVS.
Oh, she works for CVS.
Yeah. But still an active social worker. Like, come on.
Yikes.
How much more do you need to show you that this woman is not good for counseling people?
Sustain the objection.
Did you have, sorry, Judge, did you have any permission from her parents?
We didn't have permission from her parents. We had permission from DCF, who was actually at that point the guardian of the child.
Well, the parents still had rights to the medical care, did they not?
They had rights to medical care.
All right. So why were you doing this? Was this for medical care, or was this for some other reason?
So Dr. Danielson wanted to make sure and document her skin, the condition of it, before she left the hospital and when she came back.
I thought you just said it wasn't for medical reasons.
It's not medical reasons.
Okay. Well, would you agree the parents still had their medical rights?
I'm not sure I understand your question.
Would you agree
Yes,
that
you
it's
do.
against the Johns Hopkins Bill of Patients' Rights to not obtain that consent to a procedure?
So once the child's placed in
Is that a yes
DCF
or no?
custody,
And you need to answer the question that's actually asked.
so it depends.
It depends on what.
once the child was placed in DCF custody, any permission that I needed to get, I got from DCF. That's how that works.
Well, the jury will read the orders, but the
Mhm.
orders state that the parents can still have medical control. You understand that?
Objection, Your Honor. Call for legal conclusion.
Sustained.
Would it refresh your recollection? And have you seen the court's?
No, objection.
All right. You admit that you put Maya on your lap, do you not?
I do.
And are you a member of the National Association of Social Workers?
I'm not a member of the National Association of Social Workers, no.
Were you at the time of your deposition in
I may have,
2019?
yes.
And you had to adhere to their code of ethics?
Yes,
And are you aware of what their code of ethics say as to physical contact with a child?
I'm not, I don't know exactly what they
Would it
say
refresh
today.
your recollection if I showed you?
Sure.
May I approach?
Do you have can I
Yes,
see
it's
your-
section 1.
You just show it to them.
It's in it.
Why is she even smiling?
You're allowed to see.
Welcome, Mika.
I've read it.
Would you agree that you as a social worker should not engage in physical contact with and was Maya a client?
She was a patient.
Okay. Would you agree that you should not engage in physical contact with a patient when there's a possibility of psychological harm to them?
So Maya was very
Is it
upset.
Yes or so, yes or no?
Well, it depends.
All right. Social workers who engage in appropriate physical contact are responsible for setting clear, appropriate, and culturally sensitive boundaries that govern such physical contact, correct?
Correct.
And you did not.
I feel I did.
You did not contact the parents,
No, I was asked by DCF to go in.
and a 10-year-old
Sorry, can
cannot.
you finish your answer, please?
Go ahead and finish.
I was asked by DCF to go in and tell her she wouldn't be able to go home for Christmas. She was extremely emotionally upset and crying.
Mm.
That is not authorization to put a child on your lap, is it?
I don't need authorization to comfort and provide support for a little girl who just found out she's going to have to stay in the hospital through Christmas.
Didn't your code of ethics at that time say that you were supposed to establish some boundaries and get some authorization to do so?
There's nothing about authorization to do so. And providing boundaries, the boundary is that on an everyday practice, you're not doing things like that. But children often need comfort. And so we do comfort kids.
Oh,
Even in circumstances where the child simply doesn't like you.
That wasn't how I read the situation. Maya was often engaging with me, asked me to come in the room. She asked
what
me to
choice
play
did
with
she
her.
have?
Then why would it be that witnesses here have said that her dislike for you was coming off in waves?
Objection,
Well,
Your
they said-
Honor. The state's evidence and proper question.
In truth, Maya did not like you at all, did she?
I don't know that.
Yes, you
When
do.
she was
You
at the
spent-
hospital, she often engaged with me. We laughed together. We played with Hopkins together. We read prayer cards together.
This woman should never be around any child ever.
Maya did not like you touching her, did she?
She never told me that.
You know, you had said you were pretty confident about all of these things, what you did and didn't do. But you haven't been quite confident of these in the past, such as all of the physical contact, right? Were you allowed to kiss Maya?
No, I didn't kiss Maya.
And didn't you kiss Maya?
No,
And haven't you said before you weren't sure whether you did or not?
yes,
Mm.
And you weren't supposed to be
Boom.
hugging Maya, correct?
I don't know in what context that you're asking.
But you'd said before that you were not sure. Is that true?
I would have to see that.
All right. And as to the dresses, were the dresses you gave, you said were red?
Palala took up whatever dresses were there, and I delivered the rest of whatever dresses were there.
The dress involved was blue and cream. Do you understand that?
I don't.
The evidence testimony before this jury, that the dress involved was blue and cream.
Objection, Lee.
What did you deliver a blue and cream dress
I don't
to
know.
her?
I don't know.
Was it ever in your office?
I don't know. They were in the social work office.
So if you told Jack Kowalski that you dropped off all of them and failed to drop off the cream and white dress, you would be misleading him, would you not?
Objection on the matter.
Really?
I dropped off all the dresses that we had, and Palala dropped off what dresses that she had.
As to supervision of FaceTime, you weren't required to do that, were you?
We were required to bring in the tablet.
But you weren't required by the order to supervise it, were you?
Objection, calls for legal.
Answer it.
We're ruling on that.
So we weren't required. Can I see my note?
Well, you want to see the 27th order,
Oh,
December
sure.
27th order?
Sure.
With date are you?
Okay, let's stop there and let's unpack Potato, the first portion that we just watched. Give me your thoughts.
So right at the beginning of that, she said that the pictures were taken because Dr. Danielson had said that he wanted Maya's skin condition to be photographed and documented. She said that risk management asked her, and they were taking pictures because she was going to court. The other thing is that those pictures weren't put into Maya's medical file. So if he wanted pictures taken because of her medical skin condition, why wouldn't they have been included in her medical file along with the time that she took the pictures, why she took the pictures, what she took the pictures on, when it was filed, to have a paper trail to cover her for the reasons why. Also, noting that Dr. Danielson had requested them. There was none of that. So that's a change to her story and doesn't make any sense with her medical file. And then after that, when she said that she never put she sat Maya in her lap. Maya needed comforting. Maya had pain with every touch. Like her skin would feel like it was on fire. The second thing is Maya couldn't walk. So it's not like she would get up and go over to Kathy and be like, I want to sit on your lap or I want a hug or whatever. Kathy would have had to have picked her up to sit her in her lap. And Maya said that she didn't like it. And then the whole kiss thing. Maya said that she'd kissed her on the head and would run her fingers through her hair and said to her, I'm not your mom, but I could be like your mom, which is unbelievable. Like inappropriate on every level.
Oh crap, I was muted. Sorry. So my question is, Potato, do you know?
I was like, I'm sure my delay is not like 10 seconds long now.
You're like, am I still here? I'm sorry, I was muted. I muted while you talked, but no, I was asking one question. Did this happen, this alleged lap incident, and I agree with everything you said, during the photo session, or was this on a different occasion? Do we know? 'Cause I'm unclear on that. Because I'm picturing Maya in her, sports bra and her shorts, and this woman picking her up and setting her on her lap. I don't like that. So I didn't know if it was the same incident.
But I know that there are a couple of incidents where she did this kind of thing. I think she'd sat her in her lap a couple of times. I don't know if she'd done it at the time when she had pictures taken.
Oh, okay.
But she'd done it when Maya wanted to go to the door. She'd gone with her. She wasn't supposed to go with her, but she insisted and went with her, and that's when she kissed her on the head and stuff like that, and told her that she could be like her mom.
This lady needs to be looked at as scary stuff. Scary, scary stuff. All right, let's keep going. I agree with everything you said. So I really don't have anything like to add to that, really. I want to keep going.
December 27th. May I
I'm
approach
certain,
her?
Mr. Anderson, what it is that you are attempting to show her.
I'm showing her the order of December 10th, and as part of
The judge is asking us to approach.
We're just going to breeze through this.
That comment on the screen, she comforted her when her mom died. She didn't comfort her when her mom died. All she said to her was, "I'm sorry," and then she left.
Really? I didn't know that. They approach a lot. Like they're asking, can we talk about this? Can we talk about that? There's a lot, I think, with this lady. But this guy starts to eat her alive. Just wait for it. It gets better.
What's that little sign on a judge's desk?
Oh, it means they're
I
recording.
was like, it looks like a
Isn't that
sign
weird?
like throwing up or something. It's a microphone, isn't it?
Oh, shit.
Every day in the USA, people find themselves.
Oh, no.
You testified you were Roman Catholic.
Shit.
Were you allowed to kiss Maya?
Oh, God, I had to start right there.
All the
Huh?
dresses.
Okay, here we go. Sorry about that. I hit the wrong button.
So it scrolls for.
Put your nose down, lady. Can you imagine how she treats the underprivileged
Didn't
children?
you say
Oh, God.
that these different FaceTime calls must be supervised by a social worker?
I have a time frame, Judge.
Sure, as of January 6th, 2017.
I would have to see the documentation that you're.
May I approach?
Yes.
We would never know about this lady if it wasn't for this trial. Crazy.
So these are the things that I understood
No,
that they had.
no, please.
I have to ask a question.
Oh.
You want to put up the actual exhibit?
Yes, we can put it up. It's 3217-0851, 3217-0851.
B.
Hey, Meg.
Oh, wait, practice. 0851B, please.
I agree, Rhonda.
Ms. Jackson, can I see the exhibit number, please? Yeah, 3217-0851B. Is that what you're looking for, Ms. James?
Yes.
This is where he busts her in her own lies.
No, that is not.
Get it together, guys.
Do you see the second part there? Maya has FaceTime visit with her mother at 11:05 tomorrow for 30 minutes. That must be supervised by social worker. Is that what it says?
Yes, it does.
And at that point, it did not have to be supervised by a social worker. Is that correct?
I don't know that.
Say again?
I don't know that.
Okay. Nobody ever told you what the order was?
I would have to see the order.
I'm going to use the court's order.
Objection, Your Honor.
Not that.
Objection.
Jury decide based on their knowledge.
We don't want to show the
All
order.
right. If we could, I'd like to get to your corrective action notice, which is
Her correction notice is when she was written up at work. So, brief sidebar, and then they're going to get into, and they're going to put it up on the screen, actually, her actual write-up at Johns Hopkins. Hopkins. I can't say that. She wanted to sit in there on that FaceTime. She wasn't ordered to sit in there. She was ordered to bring the tablet to the little girl and let her call her mom. She wanted to sit in there. So she told social work, oh, someone has to be in there in that email. Because she's a liar. And they're really trying to suppress this order.
Can we bring up trial exhibit 2278-036? And this is the corrective action notice.
Thank you, Paul Clank. You are super special too, my
All
man.
right. On direct examination, you spent a lot of time explaining that this was due to what, a disagreement over bringing food to someone?
Objection.
What was it?
Characterization.
What was your reasoning
So,
for the confrontation on direct examination?
so Pam had told this family that she would give them a gas card for $50, or that I would give them a gas card for $50.
Okay, I'm going to stop here because I got a few things to say. So really quick, I'm going to read this to you guys because they don't really read it through. So this is Kathy getting written up at work, and this is what it says. On 11/18 of 2016, mind you, she was hired in 09. We see that here, Potato. She had the incident with the little boy that she held down and put her knees on his chest in 07. She was arrested in 07, cleared of any wrongdoing, and then hired by this health system in 09. That's really nice to know. Especially being in the same area. She didn't even move to another area. It's not like she ran away from some stigma or, bad reputation. She stayed in the same county. So who is paying attention? That's the question. But it says here that she displayed some unprofessional behavior towards a colleague on her team and was witnessed by other staff members. It was reported by 2 witnesses that Kathy stormed into her colleague's office and stated, "Do you have a problem? I am tired of all these emails. I only have a certain amount of time to get things done. Do you want to take this outside?" The witness reported that they asked for them to take it to another location. The witnesses reported Kathy was very loud and aggressive. It is reported that this created a very tense environment for all parties. Kathy realized that she was wrong and tried to apologize to her colleague in person and later sent an email to her colleague. The aforementioned behaviors do not exhibit JHACH's expectations of interdisciplinary teamwork and cordial professional interactions. She was like, "Cash me outside. How about that?" Potato, you got any thoughts on this? I'll take that as a no.
My
Oh, there you are.
God, I was muted.
It's okay. You get a pass.
Yeah, the fact that she went that far over someone sending her emails. She had to go down there, storm into the office, whatever, and be like, "You want to take this outside?" Like, what? Who is she? What is the problem? And I'm gonna guess that it's not the first time that kind of thing happened, but it's probably the first time that they went so far as to report her.
She sounds like a real bully. All right, let's keep going. I just wanted to read that so people would know. I know. "Do you have a problem? I'm tired of your emails. Cash me outside."
We weren't allowed to just give out gas cards, and this family lived really close to the hospital. So there were rules around that.
Well, ma'am, let me simply ask you, do you see anywhere in Exhibit 2278-036, and I'll show you the second page, where any of that is actually in the corrective action notice? And can we scroll up and then show the second page? You hand wrote a comment, did you not?
I did.
Taking a look at that, do you see anywhere where you mentioned any of that at the time?
No, I didn't mention any of that at the time.
And this was apparently your 3rd time, was it not? With having confrontations with people?
Objection.
Not that I'm aware of.
Didn't you say that you had to be, didn't
Clutch them
you have to be
pearls.
counseled on 2 prior occasions regarding professional behavior among colleagues?
I don't know what you're talking about.
Well, take a look under previous counseling corrective action.
Okay.
Kathy has been counseled on 2 previous occasions regarding professional behavior among colleagues.
I don't know what that's about.
Sure, you
just
know.
can't remember those?
I don't remember that.
Now, after this, was there any change in your status with Maya Kowalski?
No.
So risk management kept you on, right?
Yes.
You followed Maya Kowalski from floor to floor, did you not?
From the PICU to the 7th floor.
And you were the primary, if not only, social worker that dealt with her. True?
I was the primary. I wasn't the only social worker that dealt with her.
Didn't you ask to be on the team with Maya Kowalski?
I did not.
I'll get to it in a moment.
He's about to hand her ass to her.
So risk management assigned you to Maya, is that right?
It was my supervisor.
And isn't it true you were researching? I got an approach on this question.
That's what I said, Meg P. Can she put her nose any higher up? Lisa M., thank you for your Cash App. Very, very generous. Thank you. Yeah, he's about to prove her wrong. She's like, oh, I've been counseled? What do you mean? Psh, 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 psh.
You asked to follow Maya, did you not?
No, Edith Gunter asked me to stay on the case. She was my supervisor.
Can we bring up 2123-010?
Here we go. She's like, oh, really? Really? We're going to bring up these papers? I don't remember.
It says I'll continue to follow. And then does it say there that one of your, who was Nina Bagby Bishop?
She was the 7th floor social worker.
All right. And did she tell you that she thought you were wanting to continue to follow this child?
She did.
And isn't it true you wanted to continue to follow this child?
Okay, let's go back. I want to read that.
She thought you were wanting to continue to follow this child?
She did.
Okay, so she says, oh, I can't read it. Dear Kathy, Anne said you wanted to continue to follow this child. Please let me know if you plan to do this now that she is on my floor. Thanks, Nina. And then Kathy responds, I'll continue to follow, ... Disturbing. Disturbing. If she's moved to another floor, on another social worker's floor, why does this lady need to keep following her? Especially when Maya has verbally stated that she doesn't like this lady. I would think at a children's hospital, they would do their best to match a social worker with a child who feels comfortable with that social worker. And if things weren't working on the previous floor, why on God's green earth did her supervisor allow her to continue following this child around the hospital? I think she was obsessed with Maya and her mother, and even possibly maybe jealous of their family unit, because this lady seems like she doesn't have much love in her life. I mean, I don't know how else to say it. She's a mean ass woman.
And isn't it true you wanted to continue to follow this child?
No, I didn't, but I was, I was asked to follow this child, but I wasn't going to tell Nina that this was something that had been discussed between Edith and I. That wasn't appropriate or professional at that point.
According to your corrective action, you were complaining that you had responsibilities on 2 different floors. Is that right?
Yes,
And that was putting you under a great deal of stress.
it was.
And you still asked to be on Maya's case, did you not?
I didn't
Actually
ask.
asked and answered.
I didn't ask to be on Maya's case. Edith Gunter asked me to continue with the case. She was my supervisor at the time.
And again, after this, you were still kept on Maya's case, were you not?
I was.
Where's Edith
Maya
now?
did not want you around her, did she?
She did not portray that to us.
Risk management was deeply involved in all of this, is that right?
Objection, vague.
In your supervision of Maya.
Objection.
Now that you clarified it, I'll overrule the objection.
So I don't know that deeply involved. There were certainly pieces of it that were directed by risk management, but I don't know that deeply involved is the right wording.
You remember giving your deposition on January 30th?
Yes, I do.
And you remember have to come back to this too.
Oh, don't worry, Kathy. He's coming back to it. Mm.
Is it true that you had no training in CRPS at the time you were assigned?
That's true.
So you would not be able to notice any symptoms from the point of view of knowing what a CRPS symptom was.
Well, that wouldn't be my role.
Isn't that true?
That wouldn't be my role.
Okay. And you testified that Maya was yelling and used a bad word, I think, asshole or a-hole or something like that. What drugs was she on at that time?
I'm not aware of what drugs she was on.
And why is it through the rest of this period of time, or the rest of the time of the hospital, after this period of time, there isn't a single reference to any of this behavior? Yelling, cursing, anything like that?
So in your notes, we're putting down things that are necessary for the other team members to see and to know what to do. There certainly are times that people become very upset, very agitated. Parents might yell at us. Parents might be very demeaning. Kids might be very demeaning, but it's not stuff that we're going to put in the chart on a routine basis. It's just not, that's not the place for it.
Maya calls you an asshole and you're not going to document it?
Well, I'm simply asking you one question. Why is it that no other person in that hospital after this date ever said anything about Maya acting out with cursing and yelling language?
I can't speak to anybody else.
Right? And I believe you said that, do you have the chapel? Or deposition testimony?
Yes.
I'm not sure this is it, but let me see.
She's like, oh, come on. I have
But in
children
fact,
to
the chapel
abuse. I
was
got
the
to
only
go.
place that did not have a video camera. True?
Patients' rooms didn't have a video camera. The chapel didn't have a video camera. That's true.
And didn't you testify previously that you were in the chapel with Maya when taking a call,
You'd have to refresh my memory. I don't know about that.
where it opened up, the phone opened up and you were on it in the chapel with Maya?
I don't recall that.
I think this might be the lap
Let me
incident.
show you pages 142 through 145 of your deposition.
No, that's not her. No, no.
May I approach you?
When we approach.
And there they go again. Lapgate.
So Maya said that she was really excited to go to that chapel. Then when she found out that Kathy was going to go down with her, she said that it just took all the excitement out of it. She didn't want to stay there. She did her prayers and she just wanted to leave and go back to her room.
Is this after her mother passed?
I'm not actually sure.
I wonder if that's why they went to the chapel. Because that would be really, really sick. Because I think that's where she said, she touched her and stuff, was in the chapel. I'm trying to remember. I guess we'll find out when they come back.
Well, if it was after her mum had passed, it meant that I can be like your mum.
That would be even worse.
Makes it even more sick.
Mm-hmm. I agree. It's gross. This is a long one. She's just unfazed by the whole thing, too. It's amazing to me.
Haven't you testified that you never went in the chapel?
We went in the chapel. Maya did a court hearing from the chapel with her attorney at one point.
Oh.
So you were in the chapel with Maya at one point?
I was with her attorney.
I thought you said on direct that you were never in the chapel, period.
I'm sorry. I was never in the chapel alone with Maya.
You, can we bring up 1001-2026? And here you were criticizing Beata, were you not? Look at the middle of the page.
No, I wasn't criticizing anyone.
All right.
He's like, all right.
Did you not say that you had been following her for 2 years? Didn't follow Johns Hopkins recommendations over 2 years?
I did state that.
You never talked to Dr. Kreisman, did you?
I talked to Dr. Kreisman frequently.
You didn't talk to any of the outside physicians before making that statement, did you?
I talked to, for this statement, I probably followed up or looked at the chart and looked to see what was happening because we would do a chart review.
But nowhere in the chart does it say that, does it?
I can't tell you that. I wouldn't have put that unless that was something that was presented to me or something that I saw in the chart review.
In fact, you did not follow up with a single one of the doctors to find out what the reasons for, or even if she did resist this transfer or Johns Hopkins recommendations.
I'm not sure of your question.
So he pulls it up. I love it.
If you were so close to Maya, why is it that so many people, including Maya, said, strike it? Maya strongly disliked you, did she not?
She didn't present that in the hospital.
All right, let's go back and read that document because I didn't read that one. This one says action taken or intervention completed. Social worker contacted by medical team. Parents have agreed to stay, but team is concerned that the mother will change her mind. Social worker contacted CPI Lindsay from Sarasota County concerning the family's intention to leave against medical advice. Additional information or interactions with the family and their refusal to allow us to get records for other providers, and the mother is demanding that we provide medical treatment that is not within our scope of practice was discussed. And then highlighted, mother has not followed any of the previous discharge recommendations from ACH inpatient EC or outpatient over the course of the last 2 years. Also information provided to CPI that our PICU attending and patient's mother contacted Nemours. Dr. Santana concerning the outpatient program. PICU attending reports Nemours told the mother the current care the patient is receiving from other providers is not the standard of care and that it could be harmful, if not deadly, to her daughter. Mother was more focused on getting an something catheter, which Nemor said was not an option for such a young patient. Nemor stated they would assess patient for outpatient program. Mother didn't indicate she would attend that appointment. Instead, she said the attending if she would call the Cleveland Clinic and ask if they would place the catheter for the patient. CPI is coming to JHACH with a safety plan for the parents to sign that indicate the parents will stay at JHACH and will have all medical discussions outside the room without the child. The parents will agree to follow all treatment recommendations at this time. CPI Julie did come and provide the safety plan to JHACH. CPI Lindsay in Sarasota reports they are going to court in the morning and attempt to shelter the patient. Social work will remain available to provide supportive counseling to patient and patient's family surrounding patient's diagnosis and hospitalization. So that's what that says.
So many people, including Maya, said, strike it. Maya strongly disliked you, did she not?
She didn't present that in the hospital.
I'm gonna let the jury ask some questions for a moment.
Actually, Ms. Crowell's time.
Can't with her.
For now, yes.
Nothing at this time.
So it will be the jury's time if the jury has any questions.
Okay, so now they're going to get, I like when they do this, the jury questions. They're actually going over them with the judge right now. Like they all three kind of decide which ones they're going to present. So here we go. These are the questions from the jury. Maybe not. What's going on here? Yeah, that's the end of that. That's the end of that. All right, Potato, you're up.
Giving their questions. Sly.
She's awful.
So what I don't understand is she was saying that she was covering 2 floors and it was very stressful. Why, in that case, would you even, like, even if she had been asked to, why would she want to stay on Maya's case? It was a very complex case. I'm sure it was very stressful to manage. She's already stressed. That stress that she's feeling is going to be transferred onto Maya as well. It's just how it goes. You have a stressed adult, you're going to have a stressed child as well. So her reasons for staying with Maya was nothing to do with Maya, Maya and the control that she wanted to have over the situation. She didn't want to miss any part of what was going on.
Yeah, I think Kat's right. I think it fed her ego. I think 100%. Sick. At this point, I wanted to play some of her deposition because I think it's interesting to see. Let's see. This is I'm going to play just this one section, and then we can talk about it. Let's start here. All right, here we go.
Pain in children.
I
Any
don't-
criteria, any objective standards, or is this all subjective?
I think again that what we look for at all children's, that when I am actually in front of a child, what I'm looking for, and they're saying that they're in pain, we're looking to see how they're dealing with their daily functioning. We're looking to see again some of the things that they might be showing us, because not all children are going to be talking to you. So we might be looking for signs that they're uncomfortable in the bed, they're moving around a lot, they're pulling on an area that they might be in pain, they're avoiding touch. We would look to see if they were crying.
Okay, well, Maya cried, did she not?
Maya cried, but not while she was reporting pain.
Okay.
When did she cry then? When
Are
you were
saying
near
that
her?
Maya was not really in pain?
I'm not saying that at all. I'm not saying, what I'm saying is, again, that Maya did not show the same type of pain symptoms that other children showed.
She showed exactly the same pain symptoms that other children showed at certain times, and at certain times she did not, correct?
I would say that Maya's pain was different than all the time from other children's pain.
How many complex regional pain syndrome children have you treated on a regular basis?
I think we've seen 2 or 3 in the pediatric intensive care unit.
Okay. And so complex regional pain syndrome is a little different than having a broken leg, is it not?
Oh, yes.
Complex regional pain syndrome involves a burning sensation under the skin, right? It's quite painful, is it not?
I've never had it.
Well, have you read anything on it?
I have read something on it.
Okay. So
She's such a bitch. I've never
Maya's
had
symptoms
it.
of pain were consistent with children who have complex regional pain syndrome, were they not?
Again, I'm sorry. I'm shaking my head. Yes.
They were, right?
Yes.
Sorry. Okay. I mean, they weren't any different than the 2 or 3 you'd had before. Right.
Oh, they were different. Yes. No, they were different. The other kids that we had that had complex regional pain disorder were often bedridden for days at a time.
Well, so was Maya.
For the 95% of the time, Maya was up in her wheelchair, going to activities within the hospital.
So that means she didn't have it?
Except on the days when she complained of extraordinary pain, right?
95% of the time that I saw Maya was up in her wheelchair. And the times that she would report extraordinary pain would be when she was prompted by her mother.
Prompted by her mother.
Excuse me.
You finished?
You finished with the answer?
Prompted by her mother. Or if somebody asked her if she was having pain. And sometimes that was in the setting of being down in the child life department has a room, an activity center down on the 2nd floor. So I do know that there were a couple of, maybe it was the guardian ad litem or the CPIs that met her down there. And while they were watching her have these activities, she was reporting her pain as being a 10.
Okay. Is it true that Ms. Kowalski wanted to record the phone calls
Yes.
with you,
Yes,
but that you objected?
I did.
Why would you object to that?
So I think that all children's, we have a policy not to be recorded. And I was told by risk management that we weren't agreeing to be recorded in those phone calls.
Potato, did you want to weigh in here?
Yeah, on the stuff that she was saying about pain and what they look for in children with pain, like how they're acting, how they're displaying their symptoms, if they're crying, different to CRPS. But when my mom took me to the doctors, I was sent home because they said that I didn't seem like I was in pain because I wasn't reacting to the normal things that they do to test. So they press on the area, and when they release, it causes a lot of pain if you have appendicitis. And I wasn't reacting at all. Like, I didn't look like I was in pain. So I was sent home. And I got worse and worse to the point where I was sleeping all the time. And my mum had to end up phoning an ambulance. And in the ambulance, my appendix burst. So when I got to the hospital, I had to be rushed into surgery and stuff. And they said that if my mom hadn't have called the ambulance and they hadn't have blue lit me to the hospital, I would have died that night in my sleep.
Oh my
So
gosh,
it's a
no.
similar kind of situation. They would think of how I was presented. It couldn't possibly be that I wasn't reacting how they expect me to. I could have died in that situation because of the assumptions that they were making. So like with Maya, just because maybe she has a different way of dealing with her pain, like she doesn't express it the same way, they shouldn't write it off as that. Plus she'd already like been diagnosed as having that. It's just
Well,
a
first
very
of all,
dangerous situation when they start doing things like that.
I want to give Miss Mama Potato props for taking our potato to the hospital. That is so scary.
Yeah, I actually wouldn't be here. Yeah, it was bad.
Jammer
But
says props.
everyone has a different pain threshold, don't they? Like some people will react to small amounts of pain in a big way, and some people will react to massive amounts of pain, not have any kind of outwardly expression of it. You just deal with things
Yeah.
differently.
Right. And they say like everybody has a different pain threshold, right? So like here's an example. My husband has a very low pain threshold. I have a very high pain threshold. So like I don't complain about things hurting in the same manner he does. You know what I mean? We may have like both have pains, but his level of tolerance to that pain is different than mine, you know? And I think too, you talk to women who have gone through childbirth. We all experience that differently. Even though it's the same process, everybody's body is different. I just think that's a good comparison. Like labor pains. Some women say, it was easy as pie. I didn't have any, meds. I had no. Sorry, someone just drove by. God forbid they drive by the house. I'm glad they're on guard, but what was I saying? Yeah, everybody experiences is different. Some women are like, oh, the baby just fell out. Other women are like, oh my God, I was in labor for 24 hours and then I had to have a C-section. And it's just saying, I'm going to mute. I'll let you talk because I guess someone's here.
I mean, yeah, that is a good comparison as well, because obviously, like my situation when I was younger, I wasn't displaying signs of pain. When I had my kids, I didn't have any pain relief. So I've obviously got a higher pain threshold than some other people. We're all different and that, but these conditions are different for different people as well. They have different symptoms, like CRPS. Different people have different symptoms of that. So it's wrong for them to compare one child against another child. And if your child file this. It's just wrong.
Okay, you kind of cut out on that last part, but I didn't really hear the last part of what you said, but I'm not going to dare ask you to repeat it. I want to say thanks to retired Nana for her super chat. She says somehow Kathy got a girl that is 8 or 9 now. I don't know what that means. The lap thing was when she couldn't go home at Christmas. Okay. So that would have maybe been the same as the court photos, maybe. And then retired Nana, thank you again for your $5 super chat. When her mom died, that was the only time Kathy stayed away from her. Interesting. Interesting.
Yep, right, exactly. There was no physical contact. She's just like, I'm sorry. She's evil.
She really is. She really is. I completely agree. And then Buttercup's like they're asking a social worker her opinion of Maya's pain. She doesn't know. I mean, what does she know? But she doesn't even know. She's like, "Oh, I
Exactly.
read
The only
something."
person who knows is
The physician, right?
yeah, that makes her an expert. The only person who knows Maya's pain is Maya.
I just don't think that after that many days away from her mom that that a 10-year-old is going to keep up an act. I think that's silly. I think 10-year-olds would have to be constantly reminded if they were like acting, you know? They'd have to have that like constant reminder cuz they're just going to go to their natural ways. I mean, kids are not they're not going to do that. I don't think.
Well, she had dystonia as well, and that would be extremely difficult to fake every day. Like she had her in leg braces because they were worried that she was going to cause herself injury because of like her feet were turning inwards. So, and if she tries standing on them, they're just going to roll. Like she had no control over her muscles in her legs. Physiotherapy sessions as well. And I don't know if you listen to the testimony of the physiotherapist, but she was saying that she didn't have any doubts that Maya was experiencing what she was saying she was experiencing at any point. And she also said that she didn't doubt her mom as well.
Interesting. All right, so I've got another clip that I want to play. This is just to kind of close it out. We're going to hear from Maya herself. We haven't showed her at all today. So I think it's important to show her. And this is actually testimony from yesterday. So the defense, I believe, was done. And then I don't know what they brought. This is weird. They keep bringing them back in. But anyways, she was brought in for a short testimony where she was asked more questions. And I wanted to play this. So here we go.
Members of the jury want to confirm while you're away, you did not discuss this case amongst yourselves. You did no investigation and received no information. Is that all correct?
Correct.
And no one approached you about this case. Is that correct?
Correct.
Did you
No
see any media
captions,
coverage about this case?
but
okay.
it
Mr.
sounded
Anderson,
good.
your next witness, please.
We're going to recall Beata Kowalski for just 2 questions. No, I'm still under.
Ms. Kowalski, I just want to remind you that you are still under oath.
Yes.
Maya, correct me if I'm wrong, you were a little upset I did not leave you with the opportunity to explain those pictures from homecoming. Would you
Yes.
please explain to the jury what went on?
So there's 4 things I would like to touch on. So the first thing is that I got my dress the day before homecoming because I wasn't sure if I was going to be able to go. That was dependent on my physical condition and my mental condition. Secondly, I cried for an hour to my dad before that picture was taken because of how bad my leg pain was. I only ended up going was because my boyfriend is the one who paid for the ticket, and I felt too bad to say no. Third thing is that homecoming starts at around 8:30 for my high school. I went there about 9. I got dropped off, and I left before 10. I wasn't able to stay the entire time. Also, I did not post that picture, meaning the defense went as far as to look up my friend's account to get that picture.
Thank you.
Okay. Can we talk about this for a second? I was really shocked. Okay, so what happened was, thank you, retired Nana. What happened was, and I'm going to show you these photos that came out because the defense is constantly like wanting to catch her, I think, doing something. So there was a few photos that were leaked. One is her at a dance with her boyfriend. She's in a limo. And yeah, the Daily Mail also posted these. So there's the first one. And then here is another one. Hold on. These ones, I guess, are her partying, they say. I'm not really sure. This is, I think, that same night, the dance. So, like, I guess because she has, like, this health problem, she can't hang out with friends. I mean, even if she was putting her fake on, I mean, she can't live. It's weird. Okay, so here's one more. And Potato, go ahead and weigh in on this while I'm posting these.
Well, one, she sat down in both of those pictures. It's not like she stood up. It's not like she's on a dance floor dancing the night away. She's sitting. I mean, would the defense only be happy if she was literally bedbound all the time, not doing anything, never experiencing anything in her life?
Can you guys hear Summer Rue? Well, here, yeah, she's sitting there, but this one, she's standing. I'm not quite sure what this outfit's all about, but oh, they're trying to, okay, Evie. I believe the defense was trying to combat her modesty claim. However, consenting to photos and choosing this outfit is completely different to stripping a 10-year-old and photographing her. I would hope they wouldn't use these pictures as a comparison to say, oh, why would she be traumatized by the photos? I certainly hope they didn't use that. Like, I'm clutching my freaking pearls now because I hope they wouldn't use that as a comparison. Oh, what's she worried about? She's posed like this. Oh my God.
That would be absolutely ridiculous. She was forced to take her clothes off for starting posing in an outfit that you've chosen for yourself. Social worker that you don't know, basically pinning you down and taking pictures of you in your underwear.
And at 10 years old, like
oh.
she's 17 now. If she wants to dress like that, she's like basically an adult. But it's a Halloween costume, someone said.
Exactly. And the pictures that were taken in the hospital, she had no control over. I mean, even at 10 years old, she was thinking, what could happen to these pictures that have been taken of me? I don't want anyone else to see them. It's a completely different situation to this one that you might want to put out there.
And you know how sick it is at 17 years old that she has to like think about those photos that this woman still has them.
Yeah.
It's gross. It's really gross.
And
Um,
she will never know what happened to those pictures. It's also really
No.
sad that she's got to justify everything now as well.
Yeah, it really is. It really is, because they're trying to find anything they can to sway the jury, right? Here's a picture of Maya and her mom when she was younger, just to give you guys an idea. I just can't believe these ended up. I mean, I guess I can believe it that these ended up all over the tabloids, but they'll report anything. But here's Maya and her mom. It's just a really sad all the way around. Yeah, I guess she's got to think about every move she makes throughout. I mean, she can't even go to a dance with her boyfriend
Mm.
throughout this trial. But to seek out her friend's posts is a little sick. But let's finish this testimony of Maya. So she pretty much explained that, right? She let them have it. She's kind of fed up too, you can tell. She's just like, come on.
Maya, I apologize that you feel that way. I did not go into your account. Those pictures were emailed to me by several people who wanted the defense to know about them. But while we're on the subject,
Wow.
You did go out for Halloween with your friends as well, did you not?
I did.
Where did you go?
I went to a friend's house.
Did you go out in public?
Sorry.
Were you out in public?
Yes.
Downtown Venice?
No.
How late were you out?
I think I went out at around,
Does it matter?
I want to say like 9. And I got back a couple hours later.
Around 11 p.m.?
Yeah.
Okay.
Thank you, Flo.
Homecoming. When was homecoming?
It was, I think, about 2 weeks ago.
And when were you out for Halloween? Was that this past weekend?
Yes.
And there's been other times you've been able to get together with your friends during the trial as well.
True. But for limited amounts of time, and it's dependent on my condition.
One moment. Thank you for your time.
Mr. Anderson?
Nothing further, Your Honor.
Members of the jury, any questions? Okay, seeing none, Ms. Kowalski, you can go ahead and have a seat.
Thank you.
I see the transfer, just a second, please.
She's so well spoken for 17. My God. I watch it sometimes and I can't believe it.
She is.
She's really educated on what
She's
she's
very
gone
intelligent
through.
and very strong. And I can't believe that they're bringing all this stuff up now. Like, what is he trying to prove by including those pictures? I don't get it. What they've gone to court for is something that happened years ago. Like, now her pain is managed better, and that's what happens. Like, it doesn't stay the same all the time. So what is their point? It doesn't change what she experienced in the hospital.
Okay, there's another part that was played yesterday that I haven't seen. So I wanted to play this clip. This is a part of the deposition of her father. I think this is about like what her life is like now. Or in 2019, I should say. So 2 years apart, there's going to be 2 videos. 2 years apart of Maya. Oh shit, I got to share it.
To give will be the truth, the whole truth, and nothing but the truth. I swear.
Good morning, Maya. How are you doing today?
I'm doing well. How are you?
And so PE was one of your electives in 8th grade?
Yeah.
Did you pick PE this time, or was it picked for you, for lack of a better term?
I picked PE.
And what kind of activities were you participating in PE class in 8th grade?
8th grade, I was participating in everything that all the other students were. So football, any type of sport we did, all the games, and so on.
That's what I was getting at. So you don't recall having any flare-ups in 6th, 7th, or 8th grade?
Correct, no.
Have you had a flare-up since you graduated from 8th grade and you're getting ready to head into high school?
No.
So why don't you do me a favor and walk me through a typical day in Maya Kowalski's life over this summer, let's say, starting with your 4:30 a.m. workout regimen. Walk me through your workouts, what you do for hobbies, who you play with, and all the way through to when you go to bed at night.
I wake up at 4:30. I immediately go on my walk, which lasts normally 1 hour and like an hour and a half to up to an hour and 45 minutes. It just depends on the day. I come inside, I set out my yoga mat and I do some yoga. After I finish my yoga, I take a shower, get ready for the day, eat breakfast, and that's when my day really begins. So I will check my email, take out my dog. I will do the dishes, do the laundry, put away dishes, put away laundry. I will make myself lunch. I will practice piano for an hour. I try to do that every single day just to get in a routine. I really enjoy reading. That's something I love to do. So anytime I have leftover after piano, I like to just relax a little bit. And throughout the day, I'll take out my dog. Obviously, I don't just take her out once, but she doesn't have a schedule in terms of when she has to use the bathroom. And I start winding down at 5 o'clock. I have dinner with my family, and I pray, read some more, and I ultimately go to bed around, I start getting ready around 7, which sounds early, but I wake up at 4:30. So I try to get enough sleep. I don't sleep very well. And I fall asleep 8:30, 9.
So it seems like piano, if you had to rank your hobbies and interests outside of school, is piano right near the top?
Oh, yes. Piano is number 1.
In terms of your workouts, I know you said you did a little bit of yoga. Do you do the yoga after the workouts? Are those kind of 2 separate workouts, or is yoga part of your 4:30 a.m. workout regimen?
They're 2 separate workouts.
Okay. Walk me through what you do when you work out at 4:30. I just want to get an idea of the type of exercises you're doing, the duration, that kind of thing.
Yes. So I simply go around this circle here because we live in a community that is circular. I go around that 6 times, so that's 5.5 miles. And I'll do some cardio, so running. I could do some high intensity interval training, so 20 seconds of running, 10 seconds of rest, so on and so forth for however long. And then I mix that in with some power walking because obviously first thing I cannot run around the circle. I just can't do that at 4:30. So the first 3 laps, I would say, are just me walking and warming up my muscles.
Okay. And what's the when you said you do power walking, what is that?
Power walking, just faster pace walking.
Okay. Do you ever do any weight training in the morning?
I used to, but I switched halfway in the summer. So I used to do very intense cardio, and I absolutely love cardio, but now just waking up even earlier than I was before, it's easier for my body to adjust in the morning by walking first, then implementing cardio.
What about your current medications? I saw from Dr. Wassener's records that Claritin and Flonase are your only two medications you're currently taking. Is that accurate, or are you taking additional medications?
That's accurate. I'm just taking the Flonase as needed and Claritin as well, just as needed.
Is it fair to say you haven't had any ketamine or narcotic medication since you were discharged from Johns Hopkins All Children's Hospital in January of 2017?
Yes, I haven't.
You haven't?
I have not. Yeah.
Any other doctors that you're seeing outside of Dr. Wassener, or a primary care doctor that works with Dr. Wassener?
I don't think so, no.
Are you seeing a doctor that specializes in pain or CRPS currently?
No.
Do you know the last time you met with a physician who was a pain doctor?
I can't tell you. Sorry, no.
Have you had any flare-ups of your RSD or CRPS in, let's say, 2018?
I don't think I did, no.
What about 2019?
No.
And then recall by deposition, a brief deposition of Maya Kowalski, March 12, 2022.
This is the second one. This is in 2022.
Sorry, March 12, 2022.
That was 2019. Now
Ms.
we're
Kowalski,
going.
would you be so kind as to raise your right hand?
Whoa.
Do you solemnly swear or affirm the testimony you are about to give will be the truth, the whole truth, and nothing but the truth?
Yes.
Thank you.
Are you in any pain right now?
Right now I'm fine.
Are you on any medicine right now?
Thank
I
you,
have
Ange.
Just one pill, and it's for sleeping. I take Claritin, but I can't think of anything else right now. No, other than my acne medication.
You play the piano?
Yes,
So activities, sounds like you're still doing ice skating.
correct.
Okay. Any other physical activities that you do?
No, I mean I work out, but no other sports.
Okay. So working out is different for everybody. What kind of things do you do when you work out?
It just depends how I'm feeling that day. I mean, sometimes I lift weights. I like cardio more than anything. Lifting weights isn't really my thing, but I do it periodically. I swim. I like to go on bike rides, and I really like walking.
Fair to say that you're doing better now from a pain standpoint than you were in 2015.
Yeah.
Okay. And is it fair to say that you're doing better from a pain standpoint than you were in 2016?
Yeah.
Your Honor, now we would like to publish what's in evidence, a photograph that's a defense exhibit 3138-2.
Okay.
And we'll publish what's in evidence, defense 3138-5.
Why are these defense exhibits?
What's in evidence 3138-7. And we will publish what's in evidence 3404-1.
Yay, welcome, Crystal. This is where they show these photos.
And we will publish what's in evidence as 34042.
I guess she can't go in the photo booth at homecoming. These people are idiots.
And then, Your Honor, if we may take a short break at this time, and then we'll come back.
Well, I think it's time for our morning break.
Okay, so we're gonna end it there, but I just wanted to show some of like what the defense is claiming, in their defense of everything that we just watched. But I kind of showed it backwards. I showed Maya first defending those photos, but this is what they're showing. They're showing that she's thriving and doing well and using it against her, in my opinion.
Thank God that she is doing well now, though, and she can lead a somewhat normal life 7 years down the line, or however many years it was when she did her first account of her daily life. I mean, come on. And plus them asking about her ketamine, I'm sure that they know that there was a court order saying that she couldn't have it. She can't have ketamine until she turns 18.
Yeah, completely unfair. So what is your thoughts, Potato? To wrap it up, what do you think the jury is thinking about all of this?
Oof. I have
you had
no
to
idea.
guess.
I mean, it's pretty compelling, the disparities between the depositions. I mean, the stuff with Sally Smith as well. I think the stuff with her is pretty mind blowing too.
I think we should go over
I
some
don't
more
know.
of
I
the
think
testimony too.
I don't know. I think that, yeah, definitely with Sally Smith, because she's the one who got this whole ball rolling in the first place, and there is a lot on her. Not with just this case, but with other cases that she's been involved in.
Let's do a poll.
She sees herself as the expert in child abuse and stuff. She's had 20 cases of Munchausen by proxy that she's diagnosed. But the statistics are that doctors are likely to come across this maybe once in their career. It's like 1 in 100,000 cases would be Munchausen by proxy, and she's had 20. And she said that she's dealt with like 300,000 cases. So still, the math ain't mathin' on that one.
Potato said the math ain't mathin'. It's not. So I've got a poll up. If you guys want to see more, we can go over definitely Sally Smith. She was like what did they call her? The attending physician?
Yeah, she was like the, I don't know, child abuse doctor or something. That was like her main thing. She was called in if there was any suspicion of child abuse.
Yeah, and she doesn't have very good bedside manner either, so
Not
it
at
looks
all.
like
She is a huge buttocks.
Carlin says she has victims, not patients. I just can't even
It's so true.
believe.
There was a dad. Took 8 months for him to get out. He hadn't done anything wrong. And 15 of her cases were dropped from court as well, or the Munchausen by proxy.
It just really is disheartening that I live in this county and to know I've always kind of felt that Florida, and you and I have talked about this on and off since it started, right? You're the reason I started watching it because we had differing opinions on this. And my opinion has changed. My opinion has changed since I watched all of it. And that's
Yes.
why I like, the cameras and stuff. And that's why I hate that we can't see, some of these cases that we follow. But I had a differing opinion. I still think that her mother suffered from some type of mental illness that kind of contributed to her despair. it's really sad. And then to find out that the husband, she felt like her husband was going against her. Who did she really think was on her side at that point? She feels like they're turning her daughter, keeping her daughter away from her. Then her husband's like, yeah, I would leave her if I could get Maya out of the hospital. And she's like, what the heck? What am I fighting for? You know? So I see it from different aspects because I've watched a lot of this testimony. So I'd love to share more of the testimony with you guys. Because I was really mad when
That's
I heard that the
really
mom,
interesting.
how she took her own life and when, and how the son found her. I don't know if you guys know that the son actually walked into the garage after a birthday party and found his mother hanging. And then at one point in the testimony, and I'll get this clip and we'll play it next time, but they ask Maya about the necklace she's wearing. And I just felt this was a little much for the testimony because I think they're trying to really get at the jury's feels, but I felt like it was too much. She was wearing the necklace and they actually asked her about it. And she stated it was the one her mom was wearing when she unalived herself by hanging. And it was just kind of like a shocking moment to know that she had that on and it was like pulled out of her shirt, So it's kind of like, once you hear that, you're what do you say to that?
Man, that's heartbreaking.
But then they panned over to the camera
It's so
when they
sad
talked
that
about the necklace. Go ahead. Point fart.
Oh, you're waiting for me to speak.
Yeah.
I'm like, do I speak or not?
Yeah, I'm waiting for you. I said, go ahead. Okay.
Oh, it keeps on glitching out, so I miss words.
Oh, sorry. I know it's been glitching out on my end too. I'm waiting on you.
I don't know. I just think maybe it was important for her personally to wear that necklace to that particular moment because it's the only thing she has of her mom left. Like the last time she saw her mom was in hospital and she'd spent that time hoping to see her again and she never got to see her. So I don't know. I think it's just kind of that was something that she needed to do to, I don't know, feel close to her mom, I guess, during that time.
Well, I
It's
guess the
probably
part
comforting for her as well.
the part that bothered me about it was that they panned over to the brother when she said that was the necklace her mom was wearing when she died. And then they panned over to the brother and all I could think about was how traumatizing it's got to be for him to even see that necklace. Like there's just so much going on there that the brother probably has to overlook because Maya has to cope with the loss of her mother because she wasn't, she probably felt guilty, like it was her fault. So then you've got the brother who's got this trauma from finding his mom. But then she has that as a healing memento where to him, hearing her talk about that, you could just see it was just heartbreaking. That it was such a probably traumatic memory for him, but for her, it was healing. Do you get what I'm saying? Like there's just a lot of dynamics going on because they've all had these different experiences.
Mm-hmm. Yeah, I can't even imagine the trauma that her brother went through during that time. His parents are obviously going through a really tough time, and then to lose his mom on top of it, and then to find her, I don't know how you get through that kind of trauma.
And the brother just seems to always be like in the backdrop. It's just really sad. I was trying to find the clip of that, but I don't see it.
Yeah, definitely. A lot of the focus has been on Maya. I just hope that he was getting help as well.
I found it. Do you want to watch it really quick? It's only 10 minutes. You want to see the part about the necklace? Let's watch it.
Yeah.
I'm not even going to wait for you to reply. Just kidding. Okay, here we go.
For a specific time where I saw the doctors and nurses ask my mom to leave, it was only because this was the day that she had to go to work, and that was my last conversation with her. Whereas with my dad, I vividly remember people coming in and telling him that this was his last time to say goodbye to me.
So was this the last time you saw your mom?
The last time I saw my mom, my dad wasn't there. I was laying in the bed.
This was while you're in your room. Did you go?
Still in the PICU.
Still in the PICU?
Still in the PICU, yes.
So this is pretty close to when you checked in?
Yes,
got admitted?
yes. I know I was still in the PICU. My mom was like picking up her work bag and just like little things she had brought to the hospital, and she said, "I love you and I'll see you tomorrow." And I never saw her again.
Need some water? I noticed you're wearing a necklace. Why don't you explain that?
Yeah, so December 10th was my birthday. I turned 11 and I was unfortunately still in the hospital at the time. And the hospital has this program where they collect funds for children who are still in the hospital on their birthday. I was given $20 to spend. And I remember the social worker came in and she asked me what I'd like to buy. I bought a Nerf gun for my brother. I bought my mom a necklace, and then I bought my dad his favorite bag of mints because I didn't have a lot of money left over. But then my Aunt Wendy bought him this little glass Christmas tree, and we just said it was for me. But I bought my mom this very specific necklace that says "I love you" to the moon and back. It's just like she always said that to me. And then I found out later that she wore it every single day. And when she was found in the garage, she was still wearing it. And I have it on my neck right now.
Have some water.
Sorry.
We'll get through it. Can we publish 2571-001? We're going to switch for a second there, Maya, and ask you about obvious symptoms at the time of your admission. Now, the record reflects it. This is October 8th, 2016. So this would have been the day after you came in.
Yes.
And was this a Friday? And then this one would have been on a Saturday?
Correct.
All right. And what is that there?
It's a lesion, and again, the same thing. It's just smaller ones connecting.
This is what I'm talking about right here. Awful. It's freaking awful. So this is her brother, and him and his dad went to a birthday party. Mom stayed home because now we know that there was discord between mom and dad because of everything going on at this hospital. He is younger than her. And dad and brother Kyle went to a birthday party, and when they came home, they found her mother in the garage. So he saw it. And it just seems like he's just there.
I didn't realize that she'd bought that necklace for her mom.
I didn't. I forgot that part too, which makes it even more heartbreaking. I can't tell you. I have a few necklaces of my own that my kids got me at the Secret Santa shop when they're in elementary school. And it's one of those things that you get and you put on, and I get it. And now she has it. And she had no idea that her mom wore it. You know, she just knew that she gave it to her when she was 10 or 11. And that's all she knew. And then to find out she wore it every day. But then you've got this kid who has these memories. It's just it's all horrific. I just want to give him a hug, you know what?
It is.
Yep. And he'll never be the same. I mean, all this focus on Maya, and I mean, rightfully so, but I hope that he's also getting some help. And I hope he's also living his life and hanging out with friends.
Yeah, me too. Their whole family, man, just destroyed. Like none of them will ever be the same.
Mm-mm. Dana Nelson said, "This is a weird fact, but did you know you can't cry while drinking water? They taught this as a technique for management at one of my jobs for when you are coaching someone in a difficult situation." I did not know that. That's really interesting.
I didn't know that.
Her lawyer's like, "Drink the water, you're going to get through it." Like, my heart breaks for this family, and especially this boy. I just feel like I hope he doesn't get lost in the shuffle. You know what I mean? Like, without the focus on him.
Hmm. He probably feels a lot of pressure to be there for his sister as well, because
to be strong.
Obviously, this is all happening to her, and the fact that he's even there, I think, shows that he's really supportive of what she's doing, and it's important for this to go to court as well. I think because it highlights a lot of issues
for sure
that maybe wouldn't have come to light otherwise.
I agree. So I know this is all very heavy and very sad and can be very triggering. So I have, of course, in my old fashion, I got my going out video, which I meant to play this on Halloween, but I'm kind of glad I forgot because this is a really, really funny going out video. Flo, I did not know that, and I'm so sorry. She said, "My husband and I found his dad. He had unalived himself. It's too messed up to describe. You just go into robot mode." I'm so sorry, Flo. We really need this going out video now.
That's so sad, Flo.
It is. It's really sad. You guys got me all up in my feels. So we're going to go back to Halloween mode. I had that sound bite for Halloween potato. You missed it. Oh, wait. Retired Nana, thank you again for your $5 super chat. Much appreciated. When Kathy testified about talking about her family, she said she had a girl by adoption. I think Kathy was too old to bear a child. My God. I don't even want to know where she got that child from.
Oh, that's a scary thought. If she adopted. Mm.
And how easy would it be for her to locate a child in the foster care system and start the process? Probably not very.
Mm-hmm. Very easy.
She probably had a rotten womb. Carlin. Comment of the day.
I would say so too.
No, it wasn't mean. It's very fitting. She's a rotten woman. I bet she had a rotten womb. All right, so you guys, let's go into our final video. This is a good one. These are sisters, and they're both real estate agents out of Cartersville, Georgia. And they won a costume, and this is probably, I think, one of the best costumes I think I've ever seen. Watch.
How did you?
Is that not the best?
Oh my God. I never would have guessed that was a costume.
Watch it again.
That is so funny.
Watch how they jump up and down like they're bouncing.
A chilling connection between two.
Wasn't that the best? That is so clever.
That is genius idea.
Oh my God, I thought it was so cool. I love when people come up with really creative ideas. I've never seen anything like that. Oh, thank you, retired Nana. Thank you
That's
again for
still
your
before the
$5.
video started playing, though.
Go ahead. I
Oh, I was
moved on
saying
without
the
you.
still image before the video was playing. I never would have guessed that they weren't on a ride.
Right?
Like,
You
it
thought
looks
it was
so real.
You thought Wait, let's go back and look at it. Look at their feet.
Thought it
Look
was
at
a
their feet.
real ride.
Look at their feet. Underneath, look at their black feet. Look at their black pants. Watch. Wa-
Doesn't it look
watch
real
their
though?
Yeah, watch their real legs. Watch. Watch. It's awesome.
A chilling connection.
Oh, I love it.
I love how they go from one side to the other. I don't know why I find that to be so damn funny. Oh man. Retired Nana, thank you so much. You've been so generous throughout this stream. I am extremely grateful. Yesterday was rebuttals. That's why Maya was recalled. Thank you for explaining that. And thank you for your support. Oh my gosh, the costume is the best. All right. So until next time, we will go over Sally Smith in the next one, Potato.
Yes, very much want to go over Sally Smith. I was reading a lot about her today, and it's unbelievable.
If there's any other parts of the testimony that you want to go over, just save it and we'll do it. Because there's a lot of interesting things in this case, but I think it's really interesting and it's disheartening to me that I live in this county, that these people are allowed to just, get arrested for child abuse, have the charges dropped, and go on like nothing ever happened, and then get talked to numerous times at work, spout off at your coworkers. Like, how can you tell a coworker at a children's hospital, you want to take this outside? Like, you're dealing with children? A children's hospital? And I was sitting here telling Potato, this is a prestigious
You would hope
hospital.
that. Yeah. Yeah, they've seemingly had a lot of problems. But did you know that Pinellas County takes more children away from their families than any other county in Florida?
No, I
How
did
shocking is
not.
that?
Pinellas more than any other
And
county?
Sally Smith.
I did not know that.
Yep.
I would have figured like Miami area or something like that would have the most. Oh, I don't like that. So people probably don't want to take their kids to that hospital because you're going to get accused of something. So one more thing really quick. They had this Ukrainian girl take the stand yesterday during the rebuttals.
Yep. One person to say something and then
Potato. I think we're done.
What happened?
Okay, Potato. Nothing. I want to thank you, Potato, for working through this lag across the pond today. I know it hasn't been easy. 1, 2, 3, 4.
thank you as well, because I know that it's frustrating. I'm going to try and sort my internet out because this is not the one.
Yeah, it was working better before. This is something, she did something new. So, but I appreciate you guys toughing through it with us. Mike. All right, you guys, we're going to dance it out now. Thank you so much. Thanks again, Potato. Thank you for sorting me out in this case because I find it to be very interesting. So until next time, guys, say bye, Potato.
Don't make me a dog-faced lion pony soldier.
Bye, Potato.
God almighty.
All right, let's dance it out. If I can find where we dance it out from, we're definitely going to do it. If I can find it. We might be listening to. Just kidding. All right, dance it out, guys. Thank you so much. Bye. Thank you for all the memberships and everything else. Love you guys.
I don't give a damn. I don't really care about you and your problems. I don't give a damn. You talk way too much. I have heard enough about you and your problems. I don't give a damn. 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 You wanna be with me. You wanna feel something real, but I'm feeling differently. You're making plans to get to friends, but don't wanna face the fact that I ain't got time, I ain't got time for that. Staying up late, sleeping all day, dreaming about Cadillacs. Buying new shoes, hanging by the pool, sipping on Coke and Jack. Calling my phone when you feel alone, but I'll never call you back.
I ain't got time for that.
I ain't got time for that. I don't give a
Thank you, guys.
I don't really care about you and your problems. I don't give a damn. You talk way too much. I have heard enough about you and your problems. I don't give a damn. 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 You're mad at me for not giving you comfort. You say that I'm away so much, and now you don't feel the way you felt when we were younger. But that's okay for me, 'cause I don't give a damn. I don't really care about you and your problems. I don't give a damn. You talk way too much. I have heard enough about you and your problems. I don't give a damn. 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 I don't give a damn.
Roly poly, daddy's little Betty. Betty's gonna be a man someday.
Hi, Jennifer.